Hundreds of people are dying from opioid-related deaths each month, and experts are predicting that trend will continue until something changes. According to the Public Health Agency of Canada, more than 1,900 people died between January and March of this year. That's an average of 21 opioid toxicity deaths a day. This is more or less the same as last year, which is above pre-pandemic levels. And keep in mind, these numbers don't even include Manitoba. The hardest hit areas that we know of include regions in BC, Alberta, and Ontario. Those three provinces make up about 90% of the opioid-related deaths in this country.
This crisis continues to be tragic. We need to make sure that it doesn't get normalized and that this doesn't feel normal, because there's really nothing normal about thousands of Canadians dying.
The Canadian Centre on Substance Abuse and Addiction says current strategies aimed at reversing this troubling trend are not working.
We need to start figuring out ways to work together to bring forward real collaborative solutions that go all the way from the very upstream parts. This is when we're talking about prevention, all the way to harm reduction and what's needed to support people at the greatest risk of overdose.
Federal Mental Health and Addictions Minister Joe Scarpelli says Ottawa is taking it seriously, saying in a statement, measures such as increasing awareness around opioids, reducing stigma as well as barriers to accessing treatment of opioid use disorder, and authorizing supervised consumption sites are all part of our comprehensive public health approach. And on Friday, the minister is expected to announce new funding for a substance use and addictions program. But for now, current projections are showing opioid-related deaths are likely to remain high in Canada for at least the rest of the year. Joe Scarpelli, Global News.